Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health, cancer prevention, and treatment. In this video, we are going to look at common gynecological infections and their management. This would mean looking at ways of protecting women's health from the inside out. So, she looked fine until she couldn't bear the pain. Thousands of women are living with infections that are quietly damaging their reproductive health without a clue. So it is time we change that. And how do we do? Why does gynecological infections matter? 1 in 3 women worldwide will experience a gynecological infection this year. Many delay care due to stigma, myths, and lack of awareness. And these can lead to damage to their reproductive organs and also can lead to spread of these infections to others not suspecting. Most of these are treatable and many of them are preventable. So let's take action. So, what are some of the common gynecological infections that affect women? We have bacterial vaginosis, which is a bacterial infection of the vagina. We have candidiasis, which is a common fungal infection in the female reproductive system. We have trichomoniasis, which is an infection with trichomona, characterized by a greenish discharge from the vagina. We have chlamydia. We have gonorrhea. We have pelvic inflammatory diseases, which are infections that affect the upper part of the lady's reproductive parts, including the uterus, the fallopian tubes, and the ovaries. We have human papillomavirus, which is a viral infection that is commonly associated with cervical cancer. And it's an infection that can be easily prevented with vaccines. Then you have herpes simplex virus, which is a viral infection. And then we have urinary tract infections, which you can have infections of the urinary tract, including the urethra and the bladder. And you can also have upper urinary tract infection, which affect the ureters and the kidneys. These are life-threatening infections, and they may need to be treated with the intravenous antibiotics. So, let's look at some of the risk factors that women have that predispose them to get gynecological infection. The first one is having multiple sexual partners without using any protection, unprotected sex, and then we have early onset of sexual activity due to poorly developed reproductive organs. We have poor vaginal hygiene like douching, and poor stool practices, wearing tight or synthetic underwears, use of scented feminine products, weakened immunity. This is usually for people with HIV or diabetes, and we find that fungal infections are very common in patients with diabetes, especially because of the high sugars. We have antibiotic overuse, which leads to more infection with fungal infections due to disruption of the normal flora. We have invasive procedures like insertion of an intrauterine device. We have things like abortions, which predispose, and especially incomplete abortions or abortions done in unhygienic and poor healthy environments. Poor menstrual hygiene. The menstrual flow leads to more predisposition to infection, especially if there are poor hygienic practices. So, what are some of the red flags to watch to know that you have a gynecological infection? You may have abdominal vaginal discharge, a foul odor from your vagina. You may also have itching over your private parts, or poor pain on urination or irritation, pain during urination or sex. You have lower abdominal pain or pelvic pain. Bleeding between the periods could be a sign that you could be having an infection. So how do we diagnose many of the gynecological infection? The first thing is a pelvic exam, just by looking, seeing the type of discharge, what is the color, what is the amount, then doing vaginal swabs, using a speculum. A swab is done on the cervix, and this can be taken and examined in the laboratory, and then you can tell the type of microorganisms informed. A urinary test, doing pap smears for HPV, and also you can also do an STI panel, that is a testing for common sexually transmitted diseases. So what are some of the management and treatment drugs used for treatment? We have bacterial vaginosis, which is usually treated with metronidazole and avoid douching. Yeast, which is treated with the fluconazole oral or local insertion and keep the area dry. Trichomoniasis is commonly treated with metronidazole, and there is need for treatment of both partners. Chlamydia, which is treated with azithromycin, and there is need for retesting after 3 months. We have pelvic inflammatory diseases. This is treated with a combination of antibiotic, and urgent care is needed, and you may need to go through a course of antibiotic for up to 2 weeks to eradicate pelvic inflammatory disease. So what are some of the ways to prevent these gynecological infections? One is consistent use of condoms, regular gynecological checkups as necessary, human papillomavirus vaccination, good menstrual hygiene, cotton underwears as much as possible, avoid douching, and they avoid scented products. So some of the myths about gynecological infections include only sexually active women get infections, all vaginal discharges are normal, over-the-counter treatments are always safe. You may need to know what is the infection before you treat it. So know your body,